All right, hello and welcome everyone to today's webinar. I'm so happy to see everyone on this afternoon. Good afternoon to some and good morning to others. I am Betsy Page, Events and Programs Manager at the Seattle Metro Chamber, and we are so proud to be partnering with Greater Seattle Partners to bring you this great event. So we have a great panel coming up. I just have a few housekeeping items that I wanted to share with you before I turn it over to our moderator. Please note that all attendees are muted for this webinar. So we are going to have a question and answer section at the end of this panel. So if you have a question, there should be a Q&A box at the bottom of your Zoom screen. You can submit questions that way. If you have any issues with that, please feel free to chat me. There's also a chat function within Zoom that you can use, or feel free to email me as well, and my email is on the screen right there. So without further ado, I would like to welcome today's moderator, Heather Redman. Heather Redman is the co-founder and managing partner of Flying Fish Partners. She's had a multifaceted career in early stage and high growth companies, including as senior vice president at Atom Shockwave Inc., Getty Images, Photodisc Inc., the VP of business operations at Index Corporation, senior vice president at Summit Power Group. She is experienced in corporate development and finance, M&A, business development, and intellectual property strategy. With that, I'd like to welcome Heather Redman.
Thank you, Betsy. I'm so excited to be here, although I must say I'm grateful that it's evening, our time. We seem to be getting a bit of feedback. See how that is on your end. Okay, that seems better. Thank you. It's always the art of mute and unmute on these conferences, right? So it's all good. So I am delighted to welcome you all here morning and evening, and thank you for those of you who had to get up early. We are very happy to have as our presenting sponsor today Alaska Airlines, one of our great airlines that we all hope to be getting back on again soon. And we also have some terrific panelists. I'm expecting to learn so much from this presentation because you are all really at the forefront of this very important juncture in our history, and particularly in the history of international trade, as we'll discuss some more tonight. We were supposed to be, we thought, on an international leadership mission right now, and instead we are all at home in our respective Zoom environments, and lucky to be spending some time together virtually. This week we were supposed to be in Munich, Germany, and reports of coronavirus began circulating here, certainly in December. We thought it was mostly a problem that China was dealing with, but by mid-March, as Rachel, one of our panelists, is well aware, we were in the grips of the crisis ourselves. And had already had several fatalities and started our stay-at-home saga that we continue to observe now. The coronavirus has now spread to over 190 countries and has changed life as we know it. The Congressional Research Service estimates that the virus could trim global economic growth by as much as 2% per month as it continues, and could cause global trade to fall by 13%. These estimates are being updated all the time, so we're all dealing with this in real time. Today, we will hear from 4 global leaders on the impact of COVID-19 in each of their regions, how they are problem solving, and what the future will look like, particularly as we all try to do business together. So I'd like to introduce our panelists, and then we'll get into some Q&A, and then we will have time for audience questions as well, we hope. Lots to cover in our hour. So first of all, we have with us today Mr. Ivanhoe Chang. He is the director of the Hong Kong Economic and Trade Office in San Francisco. Mr. Chang represents the Hong Kong Special Administrative Region government in fostering economic ties between Hong Kong and 19 states in the western part of the United States. We like to think those are the 19 important states. I'm sure you will agree. And Mr. Chang joined the Hong Kong government as administrative officer in 1995. He spent his initial career on matters related to the establishment of the Hong Kong Special Administrative Region. And between 2012 and 2016, He was the Principal Assistant Secretary at the Commerce and Economic Development Bureau, responsible for telecommunications policy. He was also heavily involved in the promotion of the development of creative industries and the establishment of the Innovation and Technology Bureau, a topic near and dear to my heart. Thank you so much. Next, I would like to introduce Saegon Park. Saegon Park is the director of the Global Business Department of Korea's SMEs and Startups Agency, another topic near and dear to my heart. COSME, if I'm pronouncing that correctly. COSME is a nonprofit government agency to implement government policies and programs for healthy growth and development of small and medium industries in Korea, running 26 business incubators, including Korea Startup Center in Seattle, in 14 countries. As the head of Global Business Department of COSME, Mr. Park is providing leadership in helping Korea SMEs start and grow their business and cooperate with foreign companies around the world. He recently dedicated himself to managing the COSME USA office in New Jersey till February this year. Hopefully we can move that office to Seattle soon. And now it is my pleasure to introduce my friend, Rachel Smith. Deputy Executive Rachel Smith is responsible for administration of the executive staff, as well as directing strategic initiatives, external and internal policy coordination, intergovernmental relations, and communications. Rachel previously served as Director of Government Relations in the Executive's Office and has nearly 15 years of government affairs, policy, and advocacy experience, including various positions at Sound Transit and serving in the administration of Seattle Mayor Greg Nichols. Thank you, Rachel. And finally, last but not least, I'd like to introduce Ms. Alice Tsang. Alice is the Assistant Principal Economist, Greater China Research Team for the Hong Kong Trade Development Council. As the head of the Greater China Research Team, Ms. Tsang provides leadership and direction for researchers on market developments on the Chinese mainland, Hong Kong, and Taiwan. To provide market insights for SMEs to formulate business strategies, Ms. Tsang and her team regularly monitor and report on the macro environment, market trends, consumer characteristics, as well as changes in trade policy and regulations. At the industry-specific levels, the team also grasps the trends and business opportunities of Hong Kong's major manufacturing and services industries. Whew, okay, thank you. Wow, this is quite a group of experts and folks who've been on the front lines of this crisis, both from a health standpoint, but also an economic standpoint. And I love that you're all so focused on small business and particularly small technology businesses. That is absolutely terrific. I'd like to start with having each of you take 2 to 3 minutes to tell us what's happening today in your regions and countries right now during the COVID-19 crisis, and what has the evolution of the pandemic been like there? Where are you currently in the process? Are you getting ready to reopen? Are you reopened, or are you still in the stage of preparing to deal with reopening after the health crisis? I think we might start with Ivanhoe and then ask Alice to follow on, and then we'll open it up to the rest of the panel.
Thank you, Heather. I think first of all, before I begin, I'd like to give some perspective. Hong Kong is a very crowded metropolitan city with a population of around 7.5 million. If you imagine putting slightly less than double the population of the Seattle metropolitan area into only 5% of the area, you get an idea. Containing a pandemic in a crowded space like Hong Kong is a challenge itself. The first COVID-19 case was reported in Hong Kong back on January 23rd. However, our preparation started nearly 3 weeks before then, on January 4th, when we elevated our response plan to the serious level. The daily number of reported cases remained at single-digit level in the beginning, but until around mid-March, when the situation in Europe and the US worsened, and many Hong Kong residents returned from these places within a short period of time, it pushed us to a peak of around late March, with more than 60 cases in the worst day, in a single day. As of today, there are 1,048 confirmed cases in Hong Kong with 4 deaths. There have been no locally infected cases for more than 3 weeks now. I would say that the situation in Hong Kong is generally under control, but we need to remain vigilant. We have not locked down the city like what has been done across the US, but some restrictions have been introduced in certain aspects to ensure social distance. We are gradually relaxing some of those restrictions in view of the generally under control situation. So maybe I'll just start off with these. Thank you.
Alice?
Oh, yes. Hi. Greetings from Hong Kong and good morning, everyone. I may supplement a bit about like how's Hong Kong situation right now, because like I'm living here, so every day since the April, at the very beginning of April, like everything is resumed to normal. Like before, during the pandemic in February and March, we have Hong Kong government advisors like to do work from home arrangement or split team arrangement at work. But right now, like everything is resumed to normal. So people have to go to work every day and like rush hours still the same time. And then we have public concerns about like the students, right? Because like right now is the public examination period in Hong Kong. So right now only like the high school student, like the DSE student have to take their exams, but all the kindergarten, primary school, and even like high school or university students, they are like staying home. And then work school only resume at the end of May. And then like for like some restrictions in the public environment, like public area, most of the shopping malls or restaurants, they will ask you to wear a face mask before going in, and they will take your body temperature to make sure that you are not like carrying the coronavirus before going in. So everyday life's getting normal, and we are getting used to this like new normal living habit right now. So everyone on the street in Hong Kong, like 99% or almost everyone are wearing face masks right now. Yeah.
That is music to our ears. Thank you for that report. And I should say I absolutely love Hong Kong, so I'm very happy to hear that you're doing well. Sang-Gan, would you be able to tell us a little bit about what's going on in Korea in this regard?
Okay. Good afternoon, everyone. Let me talk about the situation in Korea. The first patient was detected on January 20th. As of May 12th, 2020, the total number of confirmed cases is 10,936, which is including imported cases, of which 9,670 cases have been discharged from isolation, and the number of deceased people is 258 so far. Recently, with regard to local transmission, 26 additional cases have been confirmed. Therefore, an administrative order was issued on May 8th. Nightlife venues such as clubs and bars are advised to refrain from operation by the government. KCDC, which stands for Korea Centers for Disease Control and Prevention, reminded the public to stay home and not go to work if having fever or respiratory symptoms, and to call KCDC or contact a local public health center if having prolonging fever over 38 degrees or aggravating respiratory symptoms. So I can say now we are still in recovering stage now. Thank you.
That's very good news. We've certainly watched South Korea's progress with great interest, and you appear to have done a really wonderful job in managing the situation. So thank you for that work. It gives us all hope. So Rachel, I'd love to have you talk about Seattle. We here are more familiar with what's going on, but we'd love to know more and maybe compare and contrast that with some of the experiences that you've heard from Hong Kong and Seoul.
Yes, thank you so much, Heather. Thank you to my fellow panelists and to everybody who's joined us today. We are hopefully right on your tail in terms of our next steps here. So I think in Washington State, I would characterize where we are as bending the curve, but not out of the woods, is perhaps what I would say. We are still currently under a stay-at-home order, although we are working through both at the state, regional, and local level, the metrics and the sort of steps on the go forward with reopening. And luckily, we are learning a lot from other countries. We're also actually, I'll say as an aside, learning a lot from our business community who has had experience in other countries. So Microsoft, Starbucks, our global corporations who are headquartered here are providing a lot of leadership, not just in the business community, but also with their government partners like ourselves as well. I think, we have, as a government, sort of accomplished some Herculean efforts as we have worked to modify operations in both our community and our government to deal with this crisis. And, the sort of United States public health system has naturally been under scrutiny because of this crisis. And so, I think from a local regional government perspective, we feel really proud of the work that we have done to reduce the caseloads, to save lives, to keep our hospitals functioning, and to keep as many people working in a way that is safe as possible. I think a couple of things that I'll say about sort of the uniqueness of this part of the country, this part of our state, this region that we're in here in King County is, our economy is really different than the rest of the state of Washington. It's different than much of the United States in terms of the kind of economic activity that we have here. We have, major sports teams, we have major downtowns, we have we're a global tech sector, dozens of biomedical research facilities, tourism, et cetera. So as we think about reopening our economy, we are doing that in alignment and in the context of the rest of Washington State and the country, but with the sort of unique focus of the economic reality of our community. And also our experience with the disease is different. King County was not just the epicenter of the state of Washington, it was the epicenter of the United States for this outbreak. We have had the most cases, we have had the most deaths, we have had the most hotspots, we have had the most devastation. And so as we look to reopening, we are having to be sort of mindful of the two ways we are very unique here, our economic activity and our relationship with the disease. So I think as we are, as we are learning and moving forward, we are really trying to bring a level of granularity to how we are looking at metrics and reopening in the same way that we did with our, fast and urgent shutdown that allowed us to prevent loss of life and disease spread. So are we trying to bring that thoughtful approach to the reopen to ensure that when we do, we stay reopened and that we're learning all the lessons from others around the globe.
Thank you. Very, very interesting comments from all of you. I would be curious, and I think probably our audience would be curious, particularly from our friends who have experience in Asia and maybe Hong Kong in particular. You all went through the SARS pandemic and did a good job of managing through that. We'd be curious what you are applying in terms of what you learned from that experience to this pandemic, and then also what advice you believe you would give now for the next pandemic. So sort of what did you learn from the prior crisis? What are you learning today? And what do you think we should all be thinking about going forward after this crisis? And maybe we can start with Alice on this, or Ivanhoe.
Okay, I will pick this up first then. Yeah, in 2003, the SARS happened. Like, it has been like 1,700 people got infected and almost 300 people died during that time. It was like a painful lessons for all of the Hong Kong people. And what we have learned, I think, like after that, we are all more conscious about our personal hygiene. And we always, some of us already have a stock of masks at home because like we learn like the disease can spread through via different ways of means, like for example, in water vapor or with contact, etc. So like people, when they are sick or even not, they are not sick because of the flu season, they will wear masks to protect themselves or try to help not spreading germs to others. And at the same time, because of the SARS, we learned that like household hygiene is very important because of the sewage system, and that was the main cause of the spread of the SARS at that time. So like people like with especially those kids at home will have like to wash their floors or mop their floor like with bleach water. So like once a week, or they diluted the bleach water to wash their home. So personal hygienes have really raised a lot after SARS. And during the pandemic at this time, like I think like what we have learned from the past have really helped a lot, because like in Hong Kong, no one, not even the Hong Kong government, like at the very beginning, like ordered us to wear a face mask. We do it like voluntarily, and then like this really helped a lot, like to stop the virus to spread in the local community. And actually, because like after March and in early April, all the cases like in Hong Kong are imported cases, especially those like overseas returnees coming back to Hong Kong. And then like the best way is like the Hong Kong government, what they did is to like advise like 14 days of quarantine and take like the deep throat saliva testing like once they stepping into Hong Kong. So in order to like stop or like to like stop the virus to bringing inside to Hong Kong. So I think like that is like a very significant step for the Hong Kong government, which I have done. And my third point is like because after SARS, like SARS was the new disease that no one know before, but like right now for the COVID-19, Hong Kong government like they have a transparent like information release like every day through the conference. So everyone in Hong Kong, they are aware of the fears of the disease and the importance to like to protect yourself and protect your family. So that's why the personal hygiene and like all these like little things add on really help like Hong Kong to like getting back to normal very soon. Yeah.
Very interesting. Ivanhoe, did you have anything you wanted to add to that?
Yeah, I totally agree with Alice that 17 years ago, I mean, SARS taught us a very painful lesson. But the kind of experience and the practices that has been built up by the community has been very useful, actually allowing the public to shift into full gear very rapidly, actually automatically, even without the government telling them exactly what to do. They already know how to maintain the best kind of hygiene. For example, most families will have a kind of a protocol. When people come from outside back at home, they will normally disinfect their shoes, and then they will go to a shower and then take their clothes to the laundry, etc., to make sure that they're not bringing any virus back home. So down to very minute details, people are very prepared. And of course, there are other aspects which relates to the public institutions. For example, during the SARS outbreak, there was an explosive outbreak in a teaching hospital, infecting over 100 medical and nursing personnel. This not only increased the number of people infected, but also seriously impacted on the capacity of the hospitals to take care of the patients. So this time around, I mean, after the SARS, both the facilities and the protocols in the hospitals have been substantially geared up in preparation for possible another round of epidemic. I think this is also very important in ensuring that this time around we have enough experience and the facilities, etc., to take care of this. And looking ahead, I think I would concur with Alice about the transparency, which is very important. In Hong Kong, we have tried to be as transparent and as open as possible. For one thing, all the 1,048 cases, the information has been made public. Of course, we have the overriding principle of protecting privacy and personal data, but without revealing these personal data, we allow people to know what flights or cruises that the company has taken, the building that he or she resides in, have visited, or the circumstances that the virus likely might have spread. This allows those people who might have been appeared in such places to watch out for their own health condition, as well as bring in awareness to the kind of scenarios that might lead to the virus spread. So this, together with rigorous testing, contact tracing, and quarantine, has helped us a lot in containing the situation. And I believe that this kind of transparency and openness will be useful in case or when the next pandemic or epidemic will come again.
That's so interesting. I love hearing about that. I know that South Korea has also done some very innovative things with technology and very close tracking and tracing. I wonder, Sang-Gan, if you would talk to us a little bit about what you've learned from this outbreak and what you think best practices are in South Korea.
Okay. I think COVID-19 is highly infectious from the early stage and spreads rapidly. However, the fatality rate is relatively low. So a substantial number of confirmed cases in Korea are mild cases. And most of deaths have been among the elderly and those with underlying diseases. So Korea focuses on stopping spreading the virus to elderly people and those who with disease. So it's important to effectively allocate medical resources to prevent mild cases, which is over 80% of every case, from developing more severe conditions and leading to death. Korea's central and local government are working in close collaboration with civil society to promptly and systematically respond to the global spread of COVID-19. Almost every Korean follows well the guideline from the government. So far we have effectively responded to the outbreak based on participation of the citizens. For example, personal hygiene measures, social distancing, etc., without the need to take lockdown measures. This helped secure the social openness and avoided compulsory measures that may significantly affect the lives of the public. These citizens voluntarily participation in a democratic manner with a community spirit and the cooperative attitude is the key force in overcoming the COVID-19 situation in Korea. So this is the lesson we learned from the COVID-19 situation in Korea.
Thank you so much. We are all very inspired by Korea's example and look forward to more good news from your part of the world. Rachel, would love to hear what you are learning in real time as we trail a little bit behind these folks and didn't have the advantage of the training wheels from SARS. Can you talk about what we're learning in real time now here?
Absolutely, and you'll hear a theme. It's consistent with what everybody else on the panel has spoken about. So, we are, I think, have very quickly moved into the social distancing. We just yesterday did require face coverings here in King County when folks are out and about and in public spaces and can't appropriately social distance. So, there are some, I think, cultural differences in terms of folks' comfort level with doing that kind of thing here. And so we did do that as a public health directive, which is not enforceable, but is a heavy-handed recommendation. from our public health professionals to encourage folks to do that. We are also, you know, when we look at our public health system, most of the things that we discuss as a way to deal with COVID-19 are things that we do in other infectious disease space. So things like TB and Hep A, et cetera. But the scale at which we need to do them is like nothing we have ever even contemplated, really. And so when we talk about isolation and quarantine facilities, so particularly for those individuals who can't do that at their own home because they are homeless or they're in a long-term care facility or some other congregate setting, that is a place where we have really had to step up and really quickly create the kind of facilities and spaces, not nearly as quickly as building a hospital in a couple of days, but nearly as quickly to procure some of those facilities for individuals who can need to do that. We also are doing things like testing. You know, our King County Public Health as an organization doesn't really do a lot of disease testing. They go in and do kind of infection control and things like that. That is kind of a space they have had to step into in a more meaningful way than they typically do. Somebody mentioned contact tracing. That is another thing where that is something that's a function public health knows well, but not on the scale that we are looking at here. So I think, you know, the public health best practices are both well known to health officials and also very quickly learned by watching our colleagues around the globe. It is really about scaling those that is presenting the opportunities and the challenges for our local government here.
Indeed, indeed. Well, I know we have a lot of folks on who are in business, and I'd love to talk a little bit about how you feel your economies are doing, including your supply chain and your outlook for international trade. And I know this is an area of specialty for Alice, so perhaps you could talk about what is happening economically in Hong Kong and what you think will be the outlook for international trade for your region.
Okay. The economic of outlook in Hong Kong is kind of gloomy, as like the Hong Kong government just released like the GDP forecast for this year will be contracted by 4% to 7%, and the trade forecast, because due to the global slow demand in the global demand, so besides for the supply chain problems because of the lockdown in many cities, like in many countries, the main concern is like the lack of demand in the future. And for Hong Kong is a service-based company, service-based city, and like we for the trade, we are all mostly a transshipment trade between China and the rest of the world. And most of the manufacturing plants enterprise in mainland China has resumed back to work at the end of March and early April. So there are like sufficient labor and like factories are ready to get back to work. However, the problem is they are having problem on like canceling demand from the overseas buyers, or like asking like no more new orders will be placed near soon. So therefore the root is like the slow down in the global demand. And since most of the overseas markets are still experiencing lockdown and low consumer sentiment due to like social distancing and etc. So this will be the key concern of the demand side. And it is believed that like in the future, small orders and just-in-time delivery will become a norm in the global trade environment. So like manufacturers have to like shift to like timely management and like ready to take small orders in that instead of like before they are doing like big shipments. So at the also like because of the Sino-US trade war, and then like some of the manufacturers, like overseas manufacturers, have relocated their plants like not only in like China, but or like shifting from China to other like Southeast Asia countries. Like that would be like also an impact like for the like Hong Kong trade environment. But like Hong Kong as a like a regional trading hub in Asia, so like the demand like should be stable in the long run. So like HKTDC, especially like our research department, actually we did like Hong Kong Export Index quarterly. So I just would like to share like the latest like first quarter figures with you. Like this index is measured like we interview 500 like manufacturers and exporters in Hong Kong, and then we capture their like near term like forecast like for their shipment. So like the index like has punched to the record low in the first quarter this year to like 16. So like it's way below like the watershed of 50, the neutral benchmark. So like in the near future, the export environment in Hong Kong may remain gloomy, but like as I mentioned before, like the manufacturing plants in China has resumed normal, and like the global demand will be picked up like maybe after like the third quarter or the fourth quarter at the end of this year. So like there will be like a rebound in the global demand in the future. So we have to wait and see like when the COVID-19 will finally leave us alone. So like that will be the time we everyone and every countries will get back to normal business.
Yes, yes, that is the billion-dollar question, or maybe trillion-dollar question, as when will we have a respite from this? Perhaps, Ivanhoe, you could expand on this a little bit. We've seen some good public-private partnerships as well in various parts of the world, and so I'd be interested to hear both from you and Alice what you think is successful in terms of government and maybe private economic development efforts. We've talked some about your expertise in the technology sector. So what are you seeing in terms of successful ways to get the economy restarted sooner and get that demand flywheel working again? Maybe the two of you can comment on that, or Ivanhoe, if you want to take a shot at it.
Just very briefly, Alice has mentioned that actually Hong Kong is very externally oriented economy. So the extent of Hong Kong's recovery will very much depend on the global situation. Whereas locally in Hong Kong, the government, because we have quite a substantial financial reserve, that's why we are able to provide a kind of an anti-epidemic fund. We have so far already got 2 tranches already, one at $4 billion and another round at $17.6 billion. So these measures kind of help to fight the virus as well as to ease the burden on the people and the businesses, you know, with a view to hoping that the business will be able to overcome this particular difficult time. And talking about some projects that the government has worked together with the private sector in relation to this pandemic. One thing, when we talk about quarantine, there are different types of quarantine. Certainly there will be kind of a centralized quarantine, which we adopt in relation to those who have very close contacts with the confirmed patients. But we also quarantine those who are incoming from outside. Of course, we cannot get everybody who come into Hong Kong into a central area to quarantine. So what we did is that we worked with a local technology company, and we built a kind of a hand bracelet. The bracelet will be able to ensure that the person under quarantine will not be leaving his place during the quarantine period without using the personal data such as the address. The kind of technology will use a kind of Bluetooth profile or Wi-Fi profile, so that the bracelet will know what kind of Wi-Fi router is around. And then if there's a substantial change, then the bracelet, this is one of the information that utilizes to know that the person has left his usual place of residence. There are these kinds of things that has, we take advantage of the this opportunity of this pandemic, but also use it in a positive way. And of course, there are things like, for example, we have already conducted a subsidy program for the production of facial masks. For a long period of time, we have been relying on imported facial masks, like mainly from mainland China. But we have already now some 20 production lines. So in the future, we'll be having millions and millions of facial masks per month to ensure that we can go through this pandemic.
Yes, the localness of the supply chain is pretty important right now as well. Sang-Gan, I was wondering if you could speak a little bit to your economic situation and outlook for Korea this year and maybe into next, and any economic development programs that your government or your public-private partnerships may have begun that you think are good and useful for us to know about.
The economic situation in Korea is not good comparing to last year. The total of export is decreased about half of last year as of May. So, but our government and our private sector, just like my agency, closely cooperate to overcome this economic situation. I can give you another good example of excuse me, partnership between public and the private sector in medical field rather than economic field. When the COVID-19 came out first and spread rapidly in Korea, all medical staffs, doctors and nurses who have taken leaves of absence from their work to volunteer and lend a helping hand in Daegu and Gyeongsangbuk-do province, where is the epicenter of COVID-19 in early stage in Korea. In Daegu, medical experts are working on the front lines to battle the coronavirus outbreak. Exhausted mentally and physically, though, they are constantly pushing their limits to muster strength. More than 1,700 medical experts were dispatched or volunteered to help contain the COVID-19 outbreak in Daegu. We still feel proud and respect their efforts. After we can overcome the crisis of COVID-19, we also can overcome the crisis of economic situation, I think.
Thank you. Thank you. Rachel, we're still in the public health crisis, but hoping to deal with the economy. Would you like to talk about the outlook for this region and also some of the economic development efforts that you are trying to instantiate and are seeing develop over time here?
Yeah, I'll say a couple of things about that. Yes, I think right now we are still in the somewhat suspended animation, sort of economically part of the crisis. That being said, of course, we and I think other states around the country who are similarly positioned to Washington State in terms of how their leadership is approaching this crisis, we still do have essential businesses functioning. We still do have people at work and doing so safely. So there still is an undercurrent of strong economic activity that is happening that I think we all are hoping will be the bedrock of a recovery as we come out of this. I think that remains to be seen. Some of our, some of our large companies are still are able to weather this storm. And these are global companies that are able to weather the storm, but they are as reliant on what is going on in your communities as they are in what is going on in our communities. So, I think we are feeling deeply the global connections that we have and how this disease has, the level of impact that it has is really sort of unprecedented. I think, listening to all of you talk about how your governments have sort of wielded their power to both bring necessary resources to fight the disease and also to begin to bring some stimulus. We, I think, have struggled to see some of that from our federal government, but do, hope that in the go forward, if we have perhaps stumbled in some of our ability to wield government directives to responding to the disease, that hopefully we can wield some of that authority to bring economic stimulus. I think on the local level, I mean, it is hard to, it really feels like a drop in the bucket of what we can do at the local and regional level in terms of how government can approach this. But, you know, the way that we are thinking about this is, you know, there's of course the how do we as government really just drive economic activity with our own purchasing, with our own grant making, with our own, you know, enterprise of 16,000 employees and, you know, billions of dollar budget. So there's that piece of it. But really as policymakers also trying to think, how can the decisions that we make change the course of this recession that we're facing? How can we use policy and leadership to, you know, to create public works or to change, you know, bring some of our values of economic equality to some different sectors. So we're sort of thinking about that right now. So both in terms of how do we push our federal government to do what we need to do for an economic recovery and stimulus? How do we use the tools that we have as a government here? And then how do we also take advantage of our leadership space to try to drive policy that puts people back to work and puts money in their pocket?
That's terrific, Rachel. I could keep asking you guys questions all night long or morning long, as the case may be, but we do have some great questions from the audience, and Betsy is a master of trying to get through the questions that we have quickly. So I'm going to turn it over to Betsy for a moment, but thank you all for your great ideas and thoughts. I've learned a ton already.
Great, thank you, Heather. And just a note that we do have about 10 minutes remaining. So yes, if you do have a question, please do feel free to submit that via the question and answer box in Zoom. I have a question from attendee Sam Kaplan. He asks, thanks for the presentations. Rachel, thanks for you and King County's good work. South Korea has employed central quarantine as part of their test, trace, and isolation efforts, as has Vietnam and Wuhan. Will King County do this or send infected back to their households to isolate?
A great question, and I'll answer that in a couple of ways. So we have a public health officer ordered a directive for isolation and quarantine for those individuals so we have kind of two sets of individuals here. We have individuals who can go to their own home and isolate and quarantine there, and then we have individuals who don't have to do that. For all individuals, if you are awaiting a test result, we are not, you are not obligated to stay at home. For anybody that has tested positive, you are obligated to stay at home or to stay in your government provided facility. That is something that we can, public health orders are law, so we can actually get a court order to make somebody stay somewhere are wantingly going out and other individuals. That's a high bar and a heavy lift, but it is something that we have done with public health before. I'm thinking recently about a tuberculosis case. So yes, we can do that. I think, again, we are an independent people here, and so we have to take civil liberties. We have to manage that thoughtfully, but we early on worked with public health officer to put that tool in the toolbox in the event that we need it, so that we can, again, we can compel individuals, should we need to either stay at home or to stay in their government provided isolation and quarantine facility.
Great, thank you, Rachel. I have another question, this one from Peter Kwan. He asks, regarding economic recovery and businesses, are any small businesses struggling or have gone out of business in Hong Kong or Seoul? Is the government providing any sort of direct assistance for small business owners? And how about larger industries that have been impacted, such as airlines, casinos, hotels, etc.? Ivanhoe, do you want to start with that?
Yeah, maybe I'll give a shot first. I mentioned about the anti-epidemic fund the Hong Kong government has set up. So of course, one of the things is that we want to make sure that to ease the burden of the business as well as the people. So one of the things that we have done is to do a kind of a wage subsidy to companies, so as to make sure that they do not need to, fire their employees because of this economic downturn. And of course, we are also providing some subsidies to particular industries have been seriously affected by this pandemic. And in relation to airlines that is a peer who has just mentioned, of course, last year we have the Cathay Pacific starting the direct flight between Hong Kong and Seattle last April. And that Cathay Pacific as an airline has been very directly impacted because of nobody is really flying nowadays. So it has already also got a kind of subsidy from the government as well.
Great. Alice, anything to add from your perspective on Hong Kong?
Right now, we can see that many small restaurants have been closed down because of the lack of tourists, and people are mostly stay at home and don't go out for dining. And but Hong Kong government has also have different kinds of funding to support to pay the wages for the restaurant, so help them to cover the stage of COVID-19. And for the SMEs, and when they do exhibitions, actually Hong Kong government also have funding to provide them to cover the expenses when they are going having exhibitions in Hong Kong or going overseas. So actually Hong Kong government is getting different kind of measures to help Hong Kong businessmen and environment to recover from the pandemic.
Great, thank you. Sang-Gong, anything to add from the South Korea perspective?
Yes, Korean government implement several kinds of policies for boosting economies in this situation. Government provides taxation benefits for SMEs, such as postponing the payment of tax about half a year for every SMEs, and then give subsidies for SME if some SMEs keep their employment at the same level comparing to the before the coronavirus situation. And the third policy is for all citizens and all SMEs. Government give about $200 for every citizen. This which is used for only small stores, not big stores. So it can make our Korea's economic situation better. Regarding big company is also in the big trouble, especially airliner are in big trouble. So our government and the big bank is considering the special loan for those kind of big company. But almost every policy, I think, is still focused on the SMEs, not the big company. So I think these are the frame our government and the bank is considering or implementing the policy for boosting Korea's economic situation.
Great, thank you so much. I have another question. This might actually be an appropriate one to end on. Talking about the future, what does the future of your city and country look like from your perspective going forward, from both the public health and economic view?
I think I'm not sure what is coming after COVID-19, because the COVID-19 situation is no human beings ever experienced. So, but I believe untapped and the digital business will gain the momentum after the coronavirus outbreak. So I think this is the simple forecast for, I think, so far.
Great. Ivanhoe or Alice?
I think, first of all, it is important to note that the COVID-19 situation is not yet over. This is very important because we need to be very vigilant until we have a very reliable vaccine that is available to all. I would believe that we will continue to live in a new kind of normalcy. And this kind of normalcy where, for example, nowadays we are meeting virtually, although this technology has been around for some time, but we have not been not everybody has been utilizing it, but nowadays it has been so common. I would imagine that when this is finally open, some of these will remain. And also in Hong Kong, the kind of technology-driven things will continue to develop. Just like even in terms of the drug development, etc., we are also helping to look for cure for this kind of disease. So this will be the way forward, I mean, for the Hong Kong economy. And of course, we'll look for other kind of balanced economic activities.
Yes, I do agree with Ivan. Like Hong Kong economy will be like getting like better like after the COVID-19 has finally completed or finished. And however, it seems that we may have to live with it for a few months more or maybe a longer time. So like staying like healthy and being cautious of the personal hygiene is like very important like for everyone. So I think like in the long run, like same as like what we have learned from SARS, we will recover again and our economy will shine again.
Great, thank you so much. I think that is all the time that we have for questions today, so I'm going to turn it over to Heather for some closing remarks.
I just wanted to say thank you to our panelists and our attendees. Just great information. I hope you all will continue to chat with one another. Certainly there's lots of good info to share. And thank you to all of our attendees. I know you are all working hard on these issues as well and working hard on getting our company back, getting our country and our respective countries back to work. And thanks finally to our presenting sponsor, Alaska Airlines, who I know would like us to all get back to work. Thank you so much. Please join us on Thursday for another session. Go to seattlechamber.com to sign up. We will be talking with representatives from Munich, Dublin, and Toronto, and that should be very interesting as well. So thank you so much.
Thank you.
Thanks all.
Thank you.
Thank you. Take care.
Take care all.